My audience members, including the cat. Everyone has had a nightmare or an anxious moment. Some of the worst feelings of fear and panic fill your body. Well, that is common for people who suffer from PTSD. We tend to think we know enough about PTSD, what causes it, and who's typically affected. The truth is much broader and complex than just veterans or violent survivors. PTSD is a serious condition that is highly stigmatized and stereotyped, which leads people away from the help that they need. The more we know about this, the more people can get help from it. Author Eve Bender interviewed a veteran diagnosed with PTSD in a clinical psychiatry news and revealed PTSD does affect many service members. It can be a devastating combination of mental health conditions like anxiety or substance abuse. She mentioned in her paper how often veterans with PTSD will withdraw from social settings and experience sleep-induced horrific nightmares. The Psychiatric Annuals Journal says that sleep disturbances like insomnia and recurring nightmares are hallmarks of PTSD. It is important to bring to light the fact that more than just service members battle PTSD. Helpers during traumatic events often experience PTSD just as the victims of the event do. The concept of a moral injury comes to play here. This is when a person experiences a behavioral or psychological change after witnessing or stopping to prevent a tragic experience. This is what happens area as healthcare workers during the COVID-19 pandemic. Frontline workers like nurses were witnessing overflowing beds of dying patients at a rapid rate, an uncontrollable rate. This affected them deeply, and many suffered from PTSD symptoms because of it. A study published by the Public Library of Science found that younger age female nurses working 60 or more hours a week were at a greater risk of developing PTSD from the pandemic. Like healthcare workers, another group of people who are underrepresented in the conversation are mothers. And like healthcare workers, mothers that go through childbirth can be the happiest day of the woman's life, but it can also be one of the most stressful, painful, and traumatic experiences of their life. For a long time, it was not possible for mothers to get diagnosed with PTSD because childbirth is considered natural. But now it is proven that it can, and it can be a deeply traumatic event in some people's lives. Mothers who experience complications with childbirth, events that include like life-threatening with the baby, and mothers whose baby spends a lot of time in the NICU have a higher chance of developing PTSD from the experience. Mothers with PTSD can withdraw from engaging with the baby and are at a risk of developing postpartum depression, according to the article of Journal Current Psychiatry. As is clear, PTSD is a difficult condition to live with, but there are some treatments that are promising. One is the use of service animals. Dogs alert when a person's adrenaline spikes and can bring them back to reality, reducing anxiety and preventing suicidal attempts. They will lay on the person's chest and prevent them from feeling anxiety, and they will put their face in the person's face to bring them back to reality. When talking with a veteran who used the service animal, Eve Bender found that the dogs greatly improve the quality of life of those who suffer from PTSD. However, it is important to remember that PTSD does not discriminate on who it will affect. Many people who have experienced PTSD can experience all sorts of symptoms, and anybody can experience these symptoms. And we do not know what will happen in our lives. Each one of us may have something traumatic happen, and it is just important to know these symptoms about PTSD, and learning more about PTSD will help us be more informed, compassionate people. And then my audience is still here.